This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. I'm Dave Wilson. Our guest this morning is Chris Hedio, disease management specialist, and we're going to be talking AFib as September is AFib Awareness Month. We'll get into the subject at hand in just a moment. Let me bring Chris into the program. Chris, good morning.
Good morning, Dave. How you doing?
Doing well. Good to have you back on the show. I know you've been on before, but you get to talk about yourself again anyway. Tell us a little bit about your background, Chris.
Yeah, so native of Fairmont, born and raised here. Did my undergrad at Fairmont State University, my postgrad work at Life University in Atlanta, Georgia. Specialized in exercise physiology and nutrition.
What led you down that road?
I just really like helping people out, trying to get the population healthier. That was kind of something I've always done, even writing exercise programs for people in high school.
So you got into it in high school, doing exercise programs?
Yeah.
What starts you down that road as a high school guy? Because, I mean, I was a guy looking for an exercise program, still looking for an exercise program for that matter, Chris. But how do you get into that? How did you come up with ideas as a high schooler?
I really just started researching. I played a lot of sports in high school and just sat down and tried to figure out what the best options were, read a lot of books, read a lot of magazines, and just kept building people programs. Anytime somebody said they wanted a workout, there it was.
So as a disease management specialist, what does that job entail, and how does that kind of include some of the stuff that you're so passionate about?
Well, I wear a lot of hats with that title. So the main thing is the base part of my job is I actually do come up with exercises and workouts for my patients. Actually have some workouts through Mon Health on YouTube that are follow along, which are great. I also help with nutrition programming for those patients, do a little bit of cardiac rehab, work with the pre-diabetic population in trying to get them healthier and, less likely to go into full-blown diabetes. And, just like to talk to people, figure out what their medications are like, their stress level, their daily habits.
We're going to get into talking about AFib Awareness Month here in just a minute, but since you brought up exercise plans and exercise routines, what is, in your experience, the biggest misconception when a patient goes to the doctor and the doctor says, hey, you need to exercise more? What is probably the biggest misconception the patient has from that statement?
That it has to be hard. Mm-hmm. That's the biggest thing that I hear. People say, I'm not capable of doing this. I'm not capable of doing that. And it's super cliche, but when you hear there's a will, there's a way. I mean, you can do anything. Sit and Be Fit every day is on PBS at 11:30 or 12 o'clock. And I tell patients that can't get around very well, tune into that. You can do that, and you're getting the activity that you need for your body.
Do you find that you have folks who, former athletes, maybe played varsity sports or even played at the collegiate level, and they think exercise workout, they think what they did when they were playing sports. Now, and like you said, they think, oh, man, I can't go back to – do you realize what we had to do when we were with, strength coach so-and-so back in the day? And you have to kind of reset your thinking, don't you?
Oh, yeah. I run into a lot of that, and, of course, Dave, I'm guilty of that myself. At 41 years old, I should probably realize that I can't work as hard as I used to.
Yeah, and do you get the opposite of that as well? Do you get the guys and girls who go, when I was 20, I could bench press 300 pounds, I could squat 400 pounds. You go, yeah, but now you're 45. Do you also have to kind of flip that mindset like you're talking about?
Yeah, you really have to just have them take a step back and say, and I've said it before to certain patients, that's where you were. You have to look at now, and you have to look at the future of where you're going. You need to be the best that you can be at this point, not the best you were at 20, 25, 30 years old.
All right, let's bring us around to AFib. It is AFib Awareness Month, atrial fibrillation. What is that, and how does it pertain to exercise?
Okay, so atrial fibrillation or AFib is an irregular, often fast heart rhythm or arrhythmia. Basically, your heart has four chambers. The top two chambers are beating chaotically and out of sync with the bottom part. By itself, Dave, believe me, it is not dangerous, although it can come with some extra symptoms, shortness of breath, fatigue, dizziness, lightheadedness. You can feel those palpitations, that rapid beating in your chest. Like I said, it's not really dangerous by itself, although it does increase your risk of stroke, aneurysm, or other heart-related conditions.
Who's at risk for AFib?
The short part of it is really anybody. We see it a lot in older populations. As you age, things in your body don't function as well as they did before. They don't work the way they're supposed to, so it does come up. It is unlikely, but we have seen it in children. And believe it or not, Dave, going back to the athletic side, we see it in athletes, specifically marathon runners, ultramarathon runners, triathletes, up to the Ironman distance, because they have that fast heart rate for a long period of time, and when they stop, their heart just kind of doesn't know what to do with itself.
And we're going to have to take the break here, Chris, so we'll tease the next segment. So you go see your primary care physician or maybe even a cardiologist. You've identified AFib, and they say, hey, kind of like where we started this conversation, you need to exercise. We'll talk about that coming up on the other side of the break, what kind of lifestyle changes you can make to help address and even prevent AFib. Chris Hedio is joining us this morning, disease management specialist. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
September is AFib Awareness Month. Chris Hedio is joining us, disease management specialist with Mon Health System, here on Mon Health Talk this morning. Okay, Chris, are there lifestyle changes you can make that will either A, help prevent AFib or help management if it's been something that's been identified?
Yeah, absolutely. Some of the key things that you could do is maintain a healthy weight. That's big. If you're overweight, losing just 5% can reduce the amount of AFib that you have and lower your risk factors. We talked about exercise, so you can definitely exercise. Try to get in that 30 minutes of moderate activity every day if you can, or at least 150 minutes a week. If you drink a lot of alcohol, that can also exacerbate the AFib symptoms. So, try to cut back on your alcohol. Don't binge drink like a lot of people did this weekend at the game. And then, avoid smoking, manage your stress, and then, speak with your doctor about controlling your cholesterol, your blood sugar, your blood pressure. All of those can affect your chance of, contracting AFib.
Give me an example, Chris. You talk about the 30 minutes of exercise, and each exercise plan you would come up with is obviously going to be individualized for the patient, the particular person, their age, and what they can do. But can you kind of give me a general example of what that 30 minutes should look like, what you should do?
Yeah, absolutely. Walking is honestly the cheapest and easiest thing you can do if you're capable of it. And I know some people have some issues that they may or may not be able to exercise by walking. Then you could do things cycling. Swimming is very, very good. But as I said, it doesn't have to be hard, and that's why I was saying walking is really good, because it's something that we normally do, and you just get out for the 30 minutes and, get you a brisk walk in, check out nature, walk at the mall, whatever you need to do.
And that kind of goes back to what we said earlier. It doesn't have to be an intense 2-hour workout where you're slinging weights. It sounds like it's about getting out and just being active in some shape, form, or fashion for 30 minutes or so. Yeah,
you got to start somewhere. And for a lot of people, if they've never exercised before, or they've been off of a layoff or on a layoff of exercise for more than 3 months, it's best to start slow, start light, and work your way up. And then as you get, stronger and feel more comfortable, seek the advice of a professional, personal trainer, like me, a disease management specialist. There's tons of information out there on the internet too.
What about diet? Do you help develop a nutrition plan, diet plan, because that can be as equally as challenging if some of your favorite foods are also some of the worst things that you can also consume when it comes to managing cholesterol and managing cardiac conditions.
Yeah, that is true, Dave. So I do work with people in changing their diet, and that's one thing is we can work on a diet plan, but I've found over the years that it's the small adjustments that make life a whole lot easier. So it may be using less salt, changing out your morning eggs for egg beaters or egg whites instead of, 4 whole eggs. Just finding healthier options of foods, because I tell my patients that I want you to eat the things you like and enjoy your life, but it doesn't, we just need to make it healthier for you.
Is that a common mistake we make in both exercise and diet? We try to make this giant, drastic change, and a week or two into it, we're tired of it and quit?
Oh, yeah. Baby steps. Baby steps. That's, when I was a personal trainer years ago, I would see that obviously January through April, people would come in and they would crush it in the gym, do these 2-3 hour workouts, and slowly you'd see them slip away until they never came again.
Yeah, it wears off. You're looking for a lifestyle change. Would that be accurate?
That is exactly correct.
And that goes back to building good habits, better habits, and like you said, those small incremental changes that don't feel so drastic, as opposed to all of a sudden going, you know what? No more sweets. I'm not having any more sweets ever again. And about 3 days later, Chris, you're craving a piece of cake in the worst way, right?
Yeah, that's exactly how it is. And it's funny, if what you need to do is take one particular thing. So say you want to switch from just eating white bread to a whole grain bread or a whole wheat bread. Commit to that for 4 weeks. After that 28-day period, your body and your mind have made a permanent change. You get used to that and you want those things. Then after that period of time, then you say, okay, now I'm going to reduce my salt and do that for 28 days. So within 2 months, you've made 2 major changes that affect your lifestyle going on.
This is a terrible comparison, Chris, and if Sarah Giosi were here, she would laugh at me, but I'm going to do it anyway because it makes sense, because I'm drinking a cup of coffee right now. It's black coffee, no sweetener, no cream. When I started drinking coffee, it was loaded with sweetener and cream. Now, if I drink a cappuccino or get one of those fancy drinks, as they're called, they're too sweet. I don't like them. Is that sort of what you're talking about?
Oh, yeah, that is definitely what I'm talking about. Definitely what I'm talking about. And it's those little things. And like you said, Dave, you get those every once in a while, and it's almost a treat. But the common factor is to make sure that you're doing the good stuff every day. So if you're drinking your coffee without that stuff, Dave, you're doing really, really well.
I'm not going to tell you about what I was eating with it. We'll just stick with the cup of black coffee. Chris Hedio joining us, disease management specialist. It is AFib Awareness Month. Any other tips you have for preventing or healthy lifestyle options to help prevent AFib? And that's the easiest way to treat diseases like this, is to hopefully prevent it from ever happening.
Yeah, that's true. Definitely try to keep those things at bay by staying active, eating the right things, and also for everybody out there, make sure to keep up with your doctors, with your appointments. If you have questions, reach out to your clinic, reach out to your provider and ask those questions, because there's no such thing as a dumb question. There's no such thing as a redundant question. Everybody needs to know this information.
Chris Hedio is joining us this morning, disease management specialist, Mon Health. We will continue the conversation right after this. It's Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Chris Hedio, our guest this morning, disease management specialist with Mon Health. We've been talking about AFib Awareness Month, but Chris, what are some of the other common diseases and ailments you treat as a disease management specialist?
I work with people that have high blood pressure, high cholesterol, diabetes or prediabetes, obesity, and sometimes people who just have questions for them and their family about, eating healthy or creating an exercise protocol.
Can someone make an appointment directly with you, or would we get a referral from our primary care physician? How does someone go about meeting with you?
Yeah, they could definitely get a referral from their primary care. They could also come through the Heart and Vascular Center here at Mon Health. As long as we get that referral into the system, I give them a call and we set it up.
And kind of give me an idea. First appointment, when a new patient comes to see you, what is that like? What would you do?
So, introductions aside, I have everybody come in and bring me a 3 to 5 day summary of what they've been eating and what they've been doing. And I tell them not to sugarcoat anything. Don't change who you are. I want to get a really good snapshot of how you do things day to day. Then we sit down and we start making those small adjustments. And in that, I give, basic recommendations on their diet, their exercise, things they need to look for and risks. And then from there, as the appointments go on, we start to build it more tailored to their needs.
I was kind of grinning as you said that. Don't sugarcoat it, Chris, because we know when we sit down, especially when you put it on paper and you go, oh man, is that my diet? Is that how little I actually exercise? Then you don't want to actually admit it to the doctor because you know what they're going to say. So I get where you're coming from. I get where I would be coming from, going, oh man, is that really what I had for supper last night? I don't want anybody to know that.
Yeah, it's a bit of a shock sometimes. People will come in and, sit down. They immediately get it, like you said, get a smile on their face, set their paper out in front of me and go, this is really bad. Mm-hmm. I tell everybody the same thing. I don't judge, and in 23 years of doing this, I have seen some things.
But the goal is, like you've said, identify it and then start to make some incremental changes that could and probably will have a dramatic impact, hopefully, toward the positive.
Yeah, absolutely. And the biggest thing is just allowing people the chance to feel comfortable and make it so that it's their decision. I'm just the guide. It ultimately comes to them. I tell each patient, you're the boss. I'm just here to help you out.
What's the key to making, and we're talking to Chris Hedio this morning, disease management specialist, but what is the key to these changes becoming a permanent lifestyle adaptations rather than, just a fad for a few weeks or a month? What's the key? Time,
patience, and perseverance. Those are the three things. You got to come in with an understanding that Rome wasn't built in a day. Neither is your body. It's going to be a process. And you have to be patient because, initially you're going to lose some big numbers if your goal is weight loss, just throwing that one out there. You may lose 3-5 pounds in the first week. You may in the second week lose another 6. And then all of a sudden you hit that point where it tapers off to 1 to 2 pounds, which is what you should lose. But people panic when they see that. It's not going fast enough, and you need to make sure to tell them that be patient. It's a process. This is a total change, not just we're getting you beach ready kind of thing.
Can you get me beach ready, Chris? I'd appreciate that.
You come see me, Dave. We'll do it.
Hey, Chris, where can folks get more information?
So they can go to monhealth.com/heart. They can speak with their primary care physician, or they can always reach out here to the clinic and speak with one of our providers.
Chris Hedio, disease management specialist. Enjoyed the conversation this morning, Chris. Thank you so much.
Yeah, definitely, Dave. Thank you.